Yeah, she's not there online, I guess.
And workers
The video
and
seen?
employees may encounter hazards and infection
Video is
risks
not
as a
seen.
result.
Video is not seen.
And
Is it
infection
seen?
risks as a result of their occupation. It is therefore necessary.
Yes, ma'am. Yes, yes. It's visible.
Yeah, you need to put it in a full screen mode.
Now it is seen?
Training and documentation.
It is not seen.
Okay. 1 minute. One minute.
Occupational safety.
Now seen,
Healthcare
Suman?
personnel and workers handling
Suman,
waste
back to
may encounter hazards and infection risks
No,
as a
Lalita,
result
it
of
is
their
not.
occupation. It is therefore necessary to prevent and control these risks. All healthcare facilities have a
Stop sharing. Let's.
responsibility to ensure the occupational safety of healthcare personnel. An occupational safety program should include provision of personal protective.
Okay. I'm sorry, I'm not able to share. I'll see
Okay.
after the class. Someone will try to
Ma'am,
share.
ma'am, you can I help, ma'am?
How will you be able to?
Ma'am, you just go for the this presentation now.
Ah,
Click over there.
yeah, present now. Yeah.
Click over there and go for the entire screen sharing.
Okay.
Then can play over this. After playing, and you can do this.
And now you see.
Yes.
Can you hear also?
Yes, ma'am.
Occupational safety.
Can you
Healthcare
hear?
personnel and workers handling waste.
Yeah, we can.
Previously, ma'am, seen right now. No.
Lalita, it has stopped. You can't see anything. Now we can see, but we can't hear. We can see but can't hear.
Ma'am, send link in chat box. We can see it.
Good afternoon.
Ma'am.
Good afternoon, everybody. Can we start? Can we start? Okay, thank you, Pawan. And all this while, what was the discussion you had with Dr. Lalita? Can I know the topic of discussion? Why am I not able to share the screen? Oh, I'm sorry. One second. Are you able to see the screen? My
Yes, ma'am.
presentation?
Yes,
Okay.
yes, ma'am.
Yeah, thank you for that feedback. We are looking at certain waste management in certain special locations. The special locations include, no, I don't know if you remember, what is that? If you remember your biomedical waste management rules, there were a few new things that were added to the biomedical waste management rules, telling even they also come under the ambit of biomedical waste management rules. That would include Ayush hospitals, veterinary hospitals were there even earlier also. They started including standalone labs, blood banks, whether they are registered or unregistered, health camps. All these things were also started adding in the they come under the ambit of biomedical, I mean, under the rules of BMW rules. So we look at what sort of waste is being biomedical waste is being generated in these specific special locations, and how we go about managing them. Are the slides moving?
Yes,
Yes.
ma'am.
Yes, is it moving? If it is not moving and not visible, please let me know. Now, when you look at Ayush, most of the places in India, we have many systems of medicine that is being practiced. And in that, you have Ayurvedic, Unani, Siddha, and homeopathy. This is also one of the systems that are being practiced in our country. So, when you look at biomedical waste management rules, how is it defined? How is biomedical waste defined? What is the definition of biomedical waste? Can somebody tell me? Because this is basic and this would have been discussed for you earlier also. Please tell me how is mean the definition of biomedical waste. Yes, I need it. If you don't give me the definition, then I will not go ahead. Please go ahead. Somebody tell me what is the definition of biomedical waste as defined in the rules. You know this. It's not new to you.
The waste generated in the healthcare facilities, ma'am.
No, that is not how it is defined under the rules, madam. The definition of biomedical waste under the BMW rules of 2016. Healthcare waste in the hospital, there will be a lot of other waste that is generated. But I need to know what constitutes biomedical waste as per the rules of 2016. It says, somebody fill in the blanks. Waste generated during, yes, the waste generated during the process of, what happens in a hospital? What do they do? What do they do in the hospital? Now, I'm not going to go forward unless somebody responds to me. Yes. What's happening in the hospital? This you should be able to tell me. Okay, should I stop the class?
May I, ma'am?
I'm asking what happens in the hospital.
Ma'am, hospital is the institute where we can be treated for patients and
Huh?
providing all. Hello,
What? I couldn't hear you, so please repeat.
hello.
Yeah.
This is a place where patients come and check. We have,
So what are you doing there? You're trying to diagnose.
yeah, you can be
You're going
diagnosed
to
first.
treat them. So and
Immunization.
immunization,
Yeah,
prevention. So any waste that is generated in the process of diagnosis, treatment, or management of
Treatment and
disease or any other. research thereof. Okay, so that means to say anything that is generated because of diagnosis. So that means to say even Ayush also comes under the process of there is diagnosis, there is treatment, there are other things also that is managed under Ayush. So therefore, even the any hospitals that are doing this will come under the ambit of biomedical waste management rules. Now, let us get ourselves familiarized with certain procedures what they do in Ayush. If there are any Ayurvedic doctors in the panel right now, I would definitely want them to explain if they are there. Anybody there? Anybody? Nobody is there? No Ayurvedic practitioners? If there are any, I would prefer them to do it. But if there is nobody, then this is what is my understanding. These are the some of the procedures what they do, that is shira vedana, that bloodletting, pari parish parishekha, that is decoction bath. There is a powder massage, there's internal oleation, induced emesis and purgation, and medicated, sorry for the spelling mistake, there is medicated enema that happens. So let's look at what is the activity they do and what type of waste is generated and under what biomedical waste management category it comes. How is a treatment and disposal that can be done? So when it looks at massages, what comes out of what type of waste is generated? It is disposable paper or cups that is used for holding these powders, cotton sheets, diapers. These are the ones which come out as waste. So, which category of waste will that go into? Yellow. How is yellow waste treated under the biomedical waste management rules of 2016? Yes. What sort of treatment is given for yellow waste under the biomedical waste management rules of 2016? What do they do with the yellow waste?
Burning in the incinerators.
Huh?
Burns in the incinerators.
It is going to the incinerator. So similarly, this decoction bath also, this powder that is used goes into yellow. The powder massage where you'll have oil and cotton soaked with oil, that also goes into yellow. This induced emesis and purgation has got infectious liquid waste that is coming out. For that, you need to have a pre-treatment because it's a liquid waste, and assuming that it is infectious, it has to be pre-treated by chemical disinfection, and then treatment here is through ETP. With ETP is the effluent treatment plant within the healthcare facility. Next is the medicated enema, where again you use catheter and gloves is the one that is the type of waste that is generated. Catheter and gloves go in for red category, and disposal is through common biomedical waste management treatment facility. But before it goes to the common treatment facility, there should be one round of no,
Pre,
I don't think pre-treatment is
yeah,
necessary.
pre-treatment.
Not necessary. If it is done on site, then you require you can do a hydroclaving, microwaving, shredding, and then you have to shred it before it is given for recycling. For bloodletting, you have gloves, needles, and soiled cotton that comes in. Gloves, as usual, goes in for red category. Needles go in for white, and soiled cotton goes in for yellow. So all these things, just as how the categorization happens with any other biomedical waste generated anywhere, the same treatment and disposal mechanism is also used here. The crux of the issue is the how we are going to put them into respective categories. So, and what sort of waste is being generated here? Similarly, in homeopathic dispensaries or clinics, what is being generated is only pills. So, pills, if at all there is any leftover there, it comes under the medicine category. So, therefore, you put it into the yellow category and goes in for incineration through biomedical waste common treatment facility. Similarly, in Siddha, it is herbs, where again it is incinerated through common treatment facility. Unani medicines are also incineration through common treatment facility. So this is how what we are looking at when you look at Ayush. Ayush stands for Ayurveda, Unani, Siddha, and homeopathy. So, all three of them, whatever waste that is being generated, based on the category, the same categories of biomedical waste applies here also. If it is yellow, it is treated for, um, it goes in for incineration. If if there is no, if there is an on-site incineration, it is done on-site, or else it is sent to a common treatment facility. Let's look at another most important one is tuberculosis. When you look at tuberculosis has a vertical program that we call it as um, National Program for Elimination of Tuberculosis. NTEP is what we call it as. For that, National Tuberculosis Elimination Program (NTEP). So for that, what they do is they try to diagnose tuberculosis. How is diagnosis of tuberculosis done? Tuberculosis is a disease which usually affects the lungs. There are other places also it affects, but predominantly it is the lungs which get affected. So whenever you are having a problem with lungs, what will happen? What is the most common symptom you find? What?
Weight loss,
Cough,
cough,
right? Cough.
tiredness,
So when lungs are involved, cough is one of the most common symptoms that is present. Correct.
Mucus also.
That is what sputum is generated. When sputum is generated for tuberculosis, what we do, we need the sputum to
Mucus.
do mucus. Okay. When there is infection, mucus, yeah. When it comes out, we call it as sputum only, no? So sputum, we do a sputum examination for um,
AFB.
AFB, acid fast bacillus, for us to find out whether the patient is positive for tuberculosis or not. So in the process, what is generated? You have those cups, sputum cups, and you have slides, used slides where you make this smear, and these are the most common things what you find in the laboratory for you. Okay, and also those sticks which when you are making the stain or anything, the sticks are used. Broomsticks, they're not very, sophisticated ones. So these are broomsticks are some of the things which are used in any laboratory for doing this. Now, how do I dispense or how do I dispose these waste is now for the sputum cups, because they are in contact with sputum, and sputum is supposed to be infective in a suspected tuberculosis patient, because so we need to treat it with utmost care, and then the sputum cups are first disinfected basically. Ideally speaking, the NTEP wants it to be autoclaved and then disposed of appropriately into a red container. But there are places where autoclaves are not available, or if they are not having a waste autoclave, then probably you can still use a chemical disinfection like 5% phenol or 5% Lysol or 1 to 2% hypochlorite solution, sodium hypochlorite solution. But the preference is still autoclave it, put it in a red bag, and then send it to the common treatment facility. Now, the question arises, what will happen to the sputum sample inside it? Ideally speaking, whatever is a sputum sample, the whole cup will will undergo disinfection. So when you are doing a disinfection, it has to be completely immersed into these chemical disinfecting agents. So you will generate some amount of chemical waste also when you have when you have a chemical disinfection as a method of disinfection. Instead, if you have an autoclave, now most of the you can put all the sputum cups into an autoclavable bag and autoclave it, which takes care. of the infection that is present inside, right? So that is one method of looking at the sputum cups. Next is your slides. Slides are one things which are generated whenever you're looking at the microscope. Now, how do I disinfect this? The slides can be reused to a certain extent until it becomes very scratchy and nothing can be seen. Till then, you can still use that slides. If you want to use it, you have to sterilize it and use it. You cannot use it before sterilization. So, before sterilization, what do? They wash it and then they autoclave it and then use it. But if you do not want to use it and want to discard it also, you have to pre-treat it with autoclaving or a chemical disinfectant and then send it to the common biomedical waste treatment facility. Why is it important for us to pre-treat even the slides or the sputum cups before discarding it into the giving it away to the common treatment facility? Is tuberculosis has the ability, the bacilli, tuberculous bacilli can survive in environmental conditions for a long duration, right? Just because you have you have stained it and then you have removed it, it doesn't mean staining means usually nothing will happen. But the sputum which is there inside, it can survive in the environment and it is likely to cause infection to others also. So to avoid that spread of the disease, we have to pre-treat all these things and then send it to the common treatment facility. And whatever wastewater or the chemical waste that is generated has to be sent to a effluent treatment plant. And the effluent that is coming out of that effluent treatment plant, that is the water that is coming out of the effluent treatment plant, should comply with the standards what the pollution control board has given for it before letting it to the. Now what, I don't know how many of you have had the experience in COVID. Were you working in a ward in COVID? What did you do during COVID times? Yes.
Ma'am, I do UPSC examination preparation.
What you did?
I did preparation of the UPSC, so I was in home.
Okay. No, if I have the, if anybody has worked during COVID, then they will know. Initially, when COVID came in, we thought it is very infectious. It is, of course, and we didn't know how the disease would do. So, what we did, whatever waste that is generated out of the COVID ward, whether it is food waste, whether it is plastic waste, whether it is cloth, whatever is the thing, everything was put into one yellow bag and sent for incineration. Right? By doing that, you have actually removed whatever segregation practices you had learned.
Things will things
Everything
will
was put into yellow
things
for incineration earlier, first beginning. Then later on, your PPE, mask, everything. Then later on, once we came to know more about the disease, and the rules, we started following the rules, we started segregation as per the biomedical waste management rules. And then the same procedures used to continue, except that we used to use a double bag for it, and we used to disinfect even the bag and the liner before sending it to the common treatment facility person. So there are certain special infectious diseases brought, say for example H1N1 or Ebola or Nipah for that matter. Even there also you have to take adequate precautions. These personal protective precautions are very important here also, and adequate disposal of the personal donning, doffing, and adequate disposal of PPE or the appropriate disposal of PPE is important even in these cases. So in Ebola, what has happened is we particularly put this case of Ebola because there is infectiousness and it is spread through blood and body fluids. So there, whenever whatever material that comes in contact with blood or body fluids, you need to pre-treat it. On-site pre-treatment of autoclaving and incineration is a must, because we do not know the infectious nature of this particular agent, and we cannot put the person who is collecting the waste into trouble because you are not doing a pre-treatment. So therefore, in such special cases, some amount of pre-treatment on site at the hospital is necessary before you send the waste across to the common treatment facility. Ideally speaking, if possible, you can incinerate there itself and or buried in a pit. When you look at a pit, the pit has to be 6 feet. It should not come in contact with any of the groundwater, and any water that is generated or it is seeped from this pit should not be contaminating any water source. So those are the criteria which you need to look at when you are looking at a deep burial pit. Now, blood banks. Is blood banks anything new for us?
Slides are not
And
changing, ma'am.
yeah,
Lights are
slides.
not changing. For me, it is
Yes, ma'am.
changing. Now it
Only
is
Ayush,
changing.
ma'am. Ayush, it
Only
is looking,
Ayushka.
ma'am. From
Yeah,
yes, ma'am.
right up.
I'll go by this only.
Yeah, correctly. This is the right way, ma'am.
This is the one. Special wards I finished. And now blood banks. In blood banks, what is the difference you will find? What is different or what is more important for us to look at in the blood bank? You may have infected blood there. That is HIV infected or HBsAg, hepatitis B infected blood can be seen. Where that blood which you cannot uh, use it anywhere, you have to discard that blood. Or any blood that is crossed their expiry period also, you cross the expiry date also, you will have to discard it. What should we do with such kind of blood that we have? How to discard it?
Treatment taking place.
One thing, I cannot discard it suo moto just like that because it is highly infectious. I am posing a threat to another person if I discard it suo moto, however I find it. So therefore, I need to pre-treat it before I send it to common treatment facility. What are my options for pre-treatment when it comes to blood bags, used or unused blood bags? Very clearly, the rule says that you have to pre-treat it, either chemical treatment or autoclave it or microwave it, and only then give it to the common treatment facility. Put the blood bag in the yellow bin, right? Other solid soiled waste like cotton or gauze or something else which gets in touch with the blood, the same thing is used as how we use in any hospital. It goes into yellow and then it is sent to the common treatment facility person. The chemical waste has to undergo through the effluent treatment plant and then treated appropriately. Blood samples also goes to the effluent treatment. Lab waste, sharps, it goes into the puncher-proof container, which is again sent to the common treatment facility. Glassware goes into blue. Infected disposable plastic goes into red, which is if needed, you can autoclave it and then send it to the common treatment facility person, where again it can be autoclaved and shredded. Mortuaries, what are there in mortuaries? What do we store?
Human bodies, ma'am.
Human
Human
body, right?
parts. Yeah,
Parts
parts
or
and health.
anything.
Yes, and health.
Postmortems are generally done. So, what are the
Biopsies.
things that would be generated
Bones.
in these places? You will have body parts will be there.
Mm.
Sharp waste can be there. Cotton. If they are embalming the body, then embalming fluid, chemical waste can happen. If they are storing it, you can have formaldehyde or glutaraldehyde, which can come into contact. Usually, bodies are stored in formalin, right? So these are the things which are there in mortuaries. How do we do body parts? It is very clearly said yellow bin goes in for incinerator. Body secretions, wherever it is being soiled, that part goes into the yellow, and from yellow it goes in for incineration. Sharp waste, you know pretty well, it goes to the white. From white it goes to, it is autoclaved, shredded, or it is autoclaved and then put and in what is it done?
Ma'am,
What happens to the sharp waste?
they invite
They are in white, sir, but what happens later on?
Cutting the parts.
No,
No,
it
sir.
is contained. No, encapsulation is what is being
Yeah.
done there. It is contained within cement and it is blocked, and that is sent to the landfill area, or it is kept in the common treatment facility for some time and later on sent to a sanitary landfill. Formaldehyde and glutaraldehyde come under chemical waste, which have to be treated. Embalming is also a chemical waste, where it is which can be sent to the effluent treatment plant, or it is discarded through the yellow. Uh, I think it goes to the ETP, and from there ETP it is neutralized, or whatever is the common thing that is there, that will be done. Now,
Ma'am, one
yes.
question is there, ma'am. In mortuaries, there is a rest cottons in which the body is sealed and plastics.
What?
Ma'am, the waste remain after this body sealing and all that.
Uh, Body is waste is
No, not body weights.
uh,
Ma'am, in which the cloth or the
yeah,
plastic,
that cloth or the whatever the body is being tied or something like that, that
right?
can go into yellow if the body is being contaminated or anything.
Okay, yellow, right. Thank you.
It can go into yellow. It comes under soiled waste. It is soiled with the body fluid of the body, whatever is which it is used. Na? So it can go into yellow, and from yellow it goes in for incineration. All right. Now next comes your veterinary hospital. Is a veterinary hospital different from a human hospital? It's just that the patients are different. Patients in a veterinary hospital, patients don't talk. Patients don't talk. Okay. You have the option of giving your treatment. The same sort of infections.
Animals treatment generally, ma'am. Here
Huh?
animals are treated. Veterinary
What?
hospitals here are animals are treated. They're like dogs, cats.
Yeah, exactly. Patients don't talk. In the sense, the animals don't talk back. All right. Here, what it's the same kind of waste that is generated. Animals also have infections. When you treat them, you generate the same set of soiled waste, solid waste, plastic waste that is there. Na? You agree with me? You don't agree with me?
No, I agree with you.
The same kind of waste. Sharps, if you want to give an injection, needle is used. There is a syringe that is generated. Needle can be separated, the syringe has to be separated. Then, if there is a delivery that happens, the placenta is generated. Okay. Similarly, if there is any cultures, if there's infection, there's cultures that are being done. The same way as what you do in your hospital, the same thing has to be done there also. Body fluids, IV tubing, or any other recyclable plastic goes into red. Vaccine vials will go into blue. Cultures will go into yellow. Those which are contaminated with blood and body fluids will go into yellow category. Sharps go into white. The same categorization and segregation that you see in biomedical waste in the hospital, the same thing applies for veterinary hospitals also. Now, the problem comes here not just in veterinary hospitals. I'll go into the next one. The pharma industry. Why we are included the pharma industry also is this pharma industry also generates waste, and whatever waste this pharma industry generates, it could be little harmful because we do not know what it is made of, the components that are made up of. Suppose it is animal, if they are doing some experiments on animals, it will become anatomical waste that we know has to go in for incineration. The problem comes with microbiological and biotechnological waste and the solid chemical waste. How do we handle these things? And the liquid effluents. The liquid effluents, all of them have to go in for ETPs. They should have a robust effluent treatment plant so that all these liquid effluents can be treated. Now, biotechnological and microbiological waste, similar way what is given here has to be pre-treated, disinfected before it is sent to the common treatment facility. Okay, and one more thing here, what we have to look at is the antimicrobials, that means antibiotics, which are manufactured there. If any of this waste or the active ingredient, some waste that is generated from this, pharma industry, if it let it out in the sewer, then there are high likely chances that the water bodies can be contaminated. Apart from that, it causes microbial resistance in the environment. If I have to control that, this antimicrobial residues have to be neutralized first. There are methods what they have mentioned by using of ultraviolet radiation or reverse osmosis or ozonation. These are some of the methods by which the fluid containing antimicrobial residues are treated before in the effluent treatment plants before letting it out outside to the water bodies. And these are certain special locations like universal immunization program. You do immunization outside the PHC, outside in the sense far off place, not just outside the PHC. Outreach activities that are done like medical camps or surgery camps or school health clinics or dental clinics or x-ray department. In all these places it's the same kind of yellow waste, sharp waste, blue color waste, and the red color waste that is generated. So you have to segregate even in these camps according to the rules and then bring it back to the um, hospital for appropriate disposal. In any of these camps, if there is too much of infectious agent that has been come in contact with any infectious agent that has come in contact with, you need to autoclave. The same rules apply. You need to autoclave before sending it to the common treatment facility person. So it means to say that I'm not doing, I mean, I will restrict myself to doing segregating waste only in the hospital will not hold good. You have to segregate biomedical waste wherever it is generated, whether it is an outreach activity of universal immunization program or a medical camp or a surgical camp or any other dental clinic or anything of that sort. Okay. Okay. Then the last thing what we have here is we there are two hazardous chemicals that we need to look out for when it comes to biomedical waste management. One is mercury, the other one is lead. In both the places, whether it is mercury or lead, they are elements. I cannot break down the elements further. I can only make compounds with them so that they are less harmful. So if you look at mercury, in most of the places it has been phased out. Okay, they are not including mercury the most common places where mercury would be utilized is the BP apparatus one, and two is the thermometer. Now you have a replacement for both these places, as you have the digital BP apparatus and you have the digital thermometer to check the temperature. Now, in only places where mercury is used very frequently is in the dental colleges, where the students have to perform amalgam fillings in the tooth whenever there is a caries tooth that is there. So, apart from that, so what will happen when there is a mercury spill? The most dangerous part is we shouldn't allow mercury to pollute any water bodies. We have a tendency to put everything into water because we feel that water takes care of every pollutants and we don't need to worry much about it. So that is why our rivers are so very polluted. So what we need to do is we have to ensure that mercury is collected properly, contained. That is the only option what we have. Containment of this mercury waste is the only option what we have for mercury. Similarly, even lead also. How we contain it? If there is any spill that is happening there, we need to see that all the mercury waste is collected in one place and stored it underwater because it can evaporate. Now, lead is again an element. Lead can cause lot of other problems just like mercury. So all I can do with lead is to contain it wherever it is there, rather than uh, contain it in such a place that it is not harmful for any one of us. Apart from that, we cannot do much anything with either lead or mercury. Now coming to e-waste. Now when you look at e-waste, what is e-waste? Yes,
Electronic waste,
Electronic waste.
Electronic waste.
electronic
Electronic.
waste. That would include your
Electronic
monitors, your
monitors,
computers,
ECG machines.
ECG machines,
Yeah,
All electronic
all electronic ones
Sy-
if
instruments
you have any
syringe,
ultrasound
syringe
machines. So
all
many
machines,
things are there.
syringe machines.
used in hospitals and
Hospitals are full
all
of
electronic products used in hospitals.
huh,
All electronic products used in hospitals.
hospitals, right? Whether it is just because it is used in hospitals, it will not come under biomedical waste. Remember this. Okay, it is a separate category of e-waste that is there, all electronic waste. It has to follow, we have to follow the rules of e-waste in managing electronic waste. Because it is generated in a hospital, it will not come under biomedical waste. Remember this. Similarly, radioactive waste. Though we use radioactive isotopes in cancer treatment, the method of treatment is not defined or told by biomedical waste management rules. They have separate rules for radioactive waste generation, containment, and doing it. These are radioactive waste management is done by Baba Atomic Research Center. They give the rules and guidelines as to how to uh, manage this radioactive waste that is generated. Okay, the basic principles in managing radioactive waste is to contain it, uh, protect it until it reaches the half-life period. Every radioisotope has one particular half-life period. Based on that, it is that is what is looked at. You need to contain it, decay, and allow it to decay until it reaches the half-life period. That is the fundamental thing what they do for radioactive waste. All right, your special locations, and one more thing that what we have is emergencies. What are emergencies you have? Natural emergencies, like there is a flood,
Natural.
earthquake,
Tsunami.
tsunami,
Tsunami.
fire, okay, any of these things. Now, after any
Some natural
emergency
disasters.
or man-made disasters, like there is a bomb blast or there is a war or any of these things can be an emergencies.
Any kind of disasters.
Any kind of disasters for that matter. So, in these emergencies, what is it that we can do about the waste is what? First is initial response will be to rescue. We may not look at these aspects immediately. First is to try and rescue whatever is there. And even in these emergencies, also, you can try and manage it depending on the situation. You assess the situation. Do you have the resources? Do you have know what kind of waste is generated? Either you can use at least a 2 bin method or a 3 bin method. Put all the sharps in one place, all biodegradable or human anatomical waste or anything, all those things which can go in for deep burial in one thing, and another set of waste which is like paper rubbish which is dry, that can all go into another waste. So either you can try a 2 bin method or a 3 bin method for us in emergencies, because in emergencies you will not have all the facilities and paraphernalia that you can utilize. So within the available resources you have to assess the situation and accordingly act. Within the available resources you need to take care of segregation, and disposal mechanisms might be used. Disposal, mostly probably you may have to use an on-site disposal because you cannot use it anywhere else. Now, one more thing, what in Ebola they were telling was, suppose you use these, you deep bury any of the material that is there in the highly infectious Ebola disease. It should not be reopened again. That means the deep burial pit has to be uh, what you call, you have to have a name to it, and it has to say that please do not open it. It has to be labeled and said Ebola waste is there. Because once you try and open it, suppose the virus is still alive or virus can still survive the environment, we are not sure about what happens. So therefore, we generally don't try to mess with what has been already disposed of. Okay. Any other clarifications you have with regard to what has been discussed today? Yes. Anything you would like to ask me?
Ma'am, please share your slides with chat or the link.
You want to share the slides on
Yeah,
the chat?
you can be
Uh,
downloaded over it.
it can be downloaded.
Yeah.
Okay, madam wanted to show occupational safety. Let me see and try if I can um, show you that. Is it visible?
Yes, no, it's visible, ma'am.
Video is visible?
No, ma'am.
No?
No, ma'am. No, ma'am.
Video is not visible. Uh, Let me see.
Ma'am, just play and go for the share. Yes.
Play and then go for sharing.
Yeah.
How do I do that?
Occupational safety. Healthcare personnel and workers handling waste may encounter hazards and
No, it's
infection
not
risks
coming.
as a result of their occupation.
No, ma'am. It's I hear the sounds, but video doesn't come.
Control
What?
these risks. Early
Sounds are coming, but
have
it
a
not showing.
responsibility
Ma'am,
to
go
No
in
ensure
the
visible,
present.
ma'am.
Ma'am,
Video.
go in the present.
Video is not visible, ma'am.
Nah,
Yes,
that's
ma'am.
what I'm trying to say. I'm trying to see that only.
Video is not there.
I'm sure I know that. Mm, it's not showing the video presentation at all.
No, ma'am. No showing video presentation.
Okay, let's see how. Now, even now?
occupational
No, ma'am.
No.
No video
How do
presentation.
we
No,
do
there are no
this?
video.
It's a technical problem, ma'am.
ये क्या technical problem है? This is really not correct.
Ma'am,
Ah,
can I help?
yeah, tell me please.
Ma'am, just go in the present now.
Present now.
Yeah, and click over there.
Where is present now? Sharing is what I have.
Yes, ma'am. Ma'am, just beside of this sender reactions के opposite में है ma'am, this side.
What?
Ma'am, where is a raise hand? It's a
Ah,
left sided there. Just
okay.
just click over there.
Yeah, I have changed layout.
No,
Apply
yeah,
visual effect.
yeah.
No.
Chrome tab, window, and entire screen.
What? Can you tell me?
Yeah, ma'am. Go in the present now.
Present now.
Just
Present now is not at all visible here.
yeah, ma'am. Just clicking over the upsided arrow.
Huh, okay.
Yeah, the three windows open. First is Chrome tab. Yeah,
Okay.
second is Windows, and third is entire screen sharing. Click on the entire and go for the sharing downward.
Entire screen. Hello.
Saying that you can do that.
Yeah, we are here.
Now can you see?
Yes, ma'am. Occupational safety comes.
Hmm.
safety.
You're
Yes,
able to
ma'am.
hear?
Healthcare
Ma'am. Yes,
personnel,
ma'am. We are
workers,
able to.
Yeah, yeah. It's now showing.
It's
hazards, and
visible.
infection risks as a result
Visible,
of
ma'am.
pollution. It is therefore necessary to prevent and control these risks. All healthcare facilities have a responsibility to ensure the occupational safety of healthcare personnel. An occupational safety program should include provision of personal protective equipment, regular health checkup of all healthcare workers, immunization, management of accidental exposure to blood and body fluids, training, and documentation. Personal protective equipment. Personal protective equipment are specialized clothing or equipment which act as barriers against infectious materials. It should be made available to all personnel who collect or handle waste. The following are to be used by all those who handle biomedical waste: cap or head cover, mask, goggles or face shield, gown, gumboots, and heavy duty gloves. Regular health checkups. According to Biomedical Waste Management Rules 2016, all healthcare personnel, including waste handlers, must be provided a medical checkup at the time of induction and thereafter once a year. Immunization. All healthcare personnel should be immunized with hepatitis B vaccine and tetanus toxoid. Management of accidental exposure to blood and body fluids. Remember, recapping is a wrong practice. It can lead to needle stick injuries. Occupational exposures to blood and body fluids can also occur through spills and splashes into the eye or mouth. When such an occupational injury occurs, do not panic. Do not put the finger into your mouth. Do not squeeze the blood from the pricked finger. Do not apply any disinfectant. What you should do is remove gloves and place hands under running water for 5 minutes. Collect blood from the source and the exposed person and send it to the lab for HIV and hepatitis B testing. Record details of the event and its follow-up in the injury register maintained at the hospital. Start post-exposure prophylaxis for HIV, preferably within 2 hours and not later than 72 hours. The exposed person must also be provided with psychological support by a counselor. Training. All healthcare personnel and waste handlers should be trained on biomedical waste management on an annual basis.
Very nice, ma'am.
Uh, okay, we can see another one also. Mercury, you can also see. Is it visible?
Yes,
Yes,
ma'am.
ma'am. It is
Yes.
visible.
Yes, ma'am.
It's visible?
It is
Yes,
Okay.
visible.
ma'am.
Okay.
Mercury, a heavy metal that vaporizes at high temperatures, is commonly used in medical instruments like thermometers and sphygmomanometers. Every nursing station must be equipped with a mercury spill kit to handle accidental mercury spills. In an event of mercury spill, follow these steps. Place a caution board and cordon the area. Remove all jewelry and wear the personal protective equipments like face mask, gloves, apron, and shoe covers. Do not use vacuum cleaners or brooms to collect any spilled mercury. Locate all mercury beads using flashlight and bring it together using cardboard or X-ray sheets. A syringe or sticky tape may be used to collect the leftover mercury beads. Place the collected mercury in an airtight plastic container half filled with water. Label and send back to manufacturer for recovery. Place all the material used during the cleanup into a leak-proof plastic bag and send this to the hazardous waste treatment, storage and disposal facility. Do not discharge any mercury into the drain or sewer. Keep the windows open to ventilate the area after cleanup. Wash hands thoroughly after cleaning. Phase out mercury from all hospitals to avoid the harmful effects on human health and environment.
Okay, we are done with the videos, both mercury as well as occupational safety. Any clarifications you would like to ask?
Ma'am, after collecting these things, where we send it?
Actually, we have to send it to any recycler,
Okay,
especially mercury, that to authorized person.
okay,
Ideally speaking, we have to just store it in a place where it is which cannot be disturbed or unnecessarily used for something else by anybody. It has to be stored. Bark is yeah. Anything? Many things were there. Okay. Sorry, I didn't see the chat box while presentation because the chat box gets obscured. Any clarifications you have? Treatment? Okay. Huh. Right. Thank you. Thank you. Any clarifications you have, or shall we call it a day? And shall I stop the meeting? Thank you. Thank you
Thank
for a
you, ma'am.
Thank you, ma'am.
thank you.
Thanks, ma'am.